back to the East Health TV. This video was created from an article on our health website. I'll drop the link to the article in the description box. After watching, please ensure you like, comment, share, and subscribe. And please do come back for more. See
Today, we're
you
talking
soon.
about something that's, absolutely essential for our health: using medications safely. A prescription is supposed to help, right? But what happens when it actually causes harm? Let's dive into how you can prevent that. Okay, let's just start with a number that might honestly shock you. Over 1 million. Yeah, you heard that right. That's how many people in the US wind up in the emergency room every single year because of a bad reaction to their medication. It's a massive number, but here's the key thing to remember. So much of this is preventable. So the big question is, how can you stay safe? We're going to build what I like to call your personal safety playbook. We'll give you all the tools you need to really understand the risks and, most importantly, take control of your own health. And the very first step is just a little bit of knowledge. We have to understand the two biggest hidden risks when you're taking medicine: side effects and interactions. Now, they might sound kind of similar, but trust me, knowing the difference is absolutely crucial for your safety. So let's break it down. A side effect is the drug's own undesirable reaction. That could be anything from a mild headache all the way to something super serious. An interaction, on the other hand, is what happens when that drug reacts with something else, maybe another medication, a vitamin supplement, or even just certain foods. These interactions, they can be really sneaky and dangerous. They can make your medicine not work as well, cause totally unexpected side effects, or even crank up the drug's power to a toxic level. The bottom line is, an interaction can completely undermine what the medicine is trying to do. All right, so how do we protect ourselves from all this? It all starts with that safety playbook we mentioned. And the number one play? It's simple, but it's so powerful. Talk to your doctor. This is such a key idea. Real prevention starts way before you even pop that first pill. Seriously, the most important thing you can do happens during that open and honest chat with your healthcare provider. So what should that conversation actually sound like? Well, here's a super simple 4-step checklist. Number 1, be completely open about all your symptoms and any health conditions you have. 2, bring a list of everything you take: other prescriptions, over-the-counter stuff, vitamins, even herbal teas. 3, tell them about any allergies or bad reactions you've had in the past. And 4, and this one's huge, don't be afraid to ask. Ask directly about side effects and what could interact with this new medicine. Your doctor needs this info to make the safest choice for you. Okay, next up in our playbook: taking your medicine the right way. Once you've got that prescription in hand, the responsibility for safety really shifts to you at home. Let's go over some really critical do's and don'ts. Do take the exact dose at the right time. Do read the label. And do store it the way it says. Now for the don'ts, and these are non-negotiable. Never share your medicine with someone else. Don't just stop taking it suddenly without talking to your doctor. And please never use old or expired prescriptions. Following these rules makes all the difference. It's also really important to know that some groups of people are naturally at a higher risk for problems. We're talking about kids, the elderly, women who are pregnant or breastfeeding, and folks with kidney or liver issues. Their bodies just process medications differently, so extra caution is a must. Okay, so let's say you've done everything by the book. But what if something still feels off? This brings us to a really important part: knowing the warning signs of a serious problem. I really need you to pay close attention here. If you experience any of these things, we're talking chest pain, difficulty breathing, a sudden bad rash, swelling, this is not a wait-and-see moment. These are major red flags, and they mean you need medical help right away. And here is the single most important thing to do if that happens. Do not try to fix it yourself. Don't look up home remedies online. Your only move is to contact a healthcare professional immediately. It could literally save your life. And that brings us to our final thought. I know this can all feel a little overwhelming, but it really comes down to this one powerful idea. Your attention and awareness are all that are needed to keep you safe. Being an active, engaged person in your own healthcare isn't just a good idea, it is your absolute best defense. So, what's one thing you're going to do differently now?
Please subscribe.